Hey, fam. It's been a busy week with school testing, therapies, dentist appointments. I mean, we have been here, there, and everywhere, and frankly, I'm beat. But I always enjoy winding down with you, fam. And this episode is extra special because we have Dr. Michael J. Greenberg, the brain behind Rumination-Focused ERP, here to share a fresh take on treatment and hope for our OCD warriors. So get cozy and pop some corn, fam, because we leave no stone unturned in this conversation, and I can't wait for you to hear more. I'm Nicole Morris, licensed marriage and family therapist and mental health correspondent, and let me be the first to say, welcome to the family, the OCD family, that is. I am here to create a community of support for family members, spouses, partners, parents, adult children, as there may be adult words, and chosen family of OCD sufferers and their community. I've had over 22 years of experience in the mental health field, but please note that this information does not qualify or substitute as a diagnostic evaluation, therapy, or treatment, and it is presented on an as-is basis. Please follow up with a qualified mental health provider in your area regarding concerns for yourself or loved ones. Thank you for joining us today. Now, let's get started. All right, fam. All right. So, my darling kiddos, I have to say, overall, I can't complain. They are great sleepers. And frankly, they are independent enough that if they wake up on the earlier side, they can entertain themselves safely until breakfast time or getting ready for school, what have you. But this week, my youngest, Emma, woke up on Wednesday morning at 4:59 a.m. And it was on a night that, for whatever reason, I usually am a pretty good, pretty solid sleeper. I just had a harder time falling asleep. So I feel like I got maybe 2 hours of sleep, and ever since, our schedule has been non-stop. So even with getting my normal 7 to 8 hours for the past 2 nights, I have to say I am still dragging. Oof. So I'm ready to settle down, hang out, and kick it back with you, fam. And today is a treat because we have Dr. Michael J. Greenberg here for an exhilarating chat on rumination-focused ERP. Now, fam, if you're new around these parts, ERP stands for Exposure and Response Prevention, which is an evidence-based practice for OCD. And for the purposes of this chat, I will say we're not going to spend a ton of time focusing on what OCD is. So if you're like, but Nicole, I'm still learning, I need that information. No sweat. You can always pause here and jump back to prior episodes or check out iocdf.org, icbt.online, or even Michael's website to grasp a better understanding. But because we want to better understand why and how Michael has developed this spin on ERP, we're going to dive into our learning and we're going to be focusing on what you could imagine, at the very least, includes rumination. He's going to give us the backstory and the context that springboarded him into developing this treatment protocol, and we are so glad he did because, honestly, I've told him and I'll tell you, fam, I've heard nothing but good things about how Michael's work has contributed to hope and freedom for OCD warriors. So let me tell you just a wee bit more about Michael, and then let's get to it. Michael is a licensed clinical psychologist specializing in the treatment of OCD, and he is the director of OCD Associates, a practice specializing in rumination-focused ERP. Much of his work is focused on the cognitive behavioral treatment of compulsive rumination, which ultimately he believes to be the cornerstone of all OCD and anxiety disorders. He has spent the past few years exploring psychoanalytic perspectives on OCD in order to better understand and treat the emotional and relational roots to this disorder, which has led him to creating this integrative approach. RFERP addresses not only symptoms, but also the underlying dynamics that generate these symptoms in the first place. And his mission is to make OCD treatment as precise and effective as possible. Also, I'll quickly mention that Michael and I either reference or discuss ACT, which is Acceptance and Commitment Therapy, Y-Box scores, which stands for the Yale-Brown Obsessive Compulsive Scale, and it's a measure that we use to help understand the severity of symptom presentations for OCD. So I try to explain along the way, fam, but there's so much that we cover. I just wanted to provide some of that initial context that might help for this conversation. So let's just get to it. Well, welcome to the OCD Family Podcast.
Hi, nice to meet you.
Hi, nice to meet you too. Thank you for taking the time. I've heard your name drop a couple different times, particularly when it comes to more mental compulsions. And people have been like, have you checked out Greenberg's rumination focus ERP? From the research I did about your work, it sounds like you started developing this understanding for RF ERP, and it really changed the way you conceptualized ERP. And it's not to say ERP isn't good. ERP got me a certain amount of the way, and ERP is evidence
Mhm.
based and it brings a lot of freedom to people.
The way I would say it is ERP is very helpful to many people.
Yeah, that is
Very
true.
helpful, but not all the way helpful. Helpful to many people, but not to all people.
Yes, I like that. Yes, it's very nice. And I think it validates people's feelings because what have we learned in all of this, whether it's OCD or not? The feelings that get triggered is really what we're working with here,
Yeah. Can
right?
I add, I think there's an interesting parallel process between how the community and providers think about ERP and just other aspects of OCD, like the need to have a magical solution to something that's immediate and complete, and the assumption that that exists, and the assumption that we can fix a problem and we know what the problem is and we know how to fix it, and if we just try hard enough, we can do it. Those are all very obsessive compulsive dynamics that are not always based in reality. And so it's interesting that that's sort of informed how the community, not just patients, but also uh,
The scientific.
therapists
Yeah,
think about ERP. Like this is a definite, complete solution to this problem. And people will say, oh, we never said that. We never said it was complete, whatever. But we use language like gold standard that really implies that, even if
yeah,
that's not literally what it means, it really implies that. And it's really how people understand it. And further evidence for this perspective on ERP is that when patients aren't getting all the way better from ERP, something is wrong. They must not be doing it right. Either the patient isn't doing it right or the therapist isn't doing it right. So when a patient isn't getting all the way better from ERP, they're not thinking, well, yeah, that's ERP. It's helpful and it's limited. They're like, there must be something wrong. And therapists, when their patients aren't getting all the way better from ERP, also think there must be something wrong. There must be something wrong with how I'm doing it. And of course, there could be
yeah, fact.
improvement. Obviously, I believe that that's why I developed this approach. I think you could improve on how you're delivering it. You could sharpen it up. You could do more. But the assumption that that leads to a complete solution is unfounded. It's not based on any data. Is just a fantasy. It's an omnipotent fantasy.
Mike, I feel, or I don't even know if you like the name Mike or if you prefer Michael. I'm so sorry.
Oh, I don't go by Mike, but you are welcome to call me whatever you
It's like in the heat of the moment, I was like, Mike, we could be friends. And then I was like,
want.
except I just called you Mike. Maybe you don't like that.
No.
But yeah, and even how we know IOCDF is a place for consumers that they're coming, that they're desperate for information and hope. And when we say first line treatments, and we even look at the 60% for ERP, 60% aren't in recovery, 60% have lower Y-box scores.
Can I add, what does recovery mean?
What does recovery mean, right?
There's one of these studies, I don't remember which one it is, but one of the original studies showing the efficacy of OCD, they turned it into a binary outcome, which was in remission or not. And remission was like a Y box of, I forget exactly, but it was like 13 and below or 12 and below. It's like, whoa, a Y box 11, a Y box 10 is somebody who still has symptoms.
Right.
And that study was calling that remission.
Right.
That's,
Yeah.
that's so wild.
Yeah.
Yeah, and that's how we get studies that say it worked in 60% of people. What did it do for 60% of people?
Right. Because 60% of the people are not feeling A-OK out there.
The assumption that there is a cure is itself not necessarily true. It's sort of like when people assume that medicine must be able to treat any disease. And then eventually in life, you come to terms with the fact that that's not true. Medicine is like, wow, they can do a lot, but they don't have, nor do they think they have answers to everything. But we
Right.
do grow up thinking you're sick, you go to the doctor, you get better. That's the whole story.
Right.
So there is a parallel process there that maybe we won't have a complete answer. Personally, I'm still living in my omnipotent fantasy era.
Yeah.
I'm still hoping that we can get people all the way better. I'll start by saying I have patients who are definitely not all the way better. It's still a struggle, still works in progress. Hopefully, I think all of them are moving in a positive direction, but certainly there are people who are still working on it. But there are also people who I have seen for OCD who really don't have symptoms anymore.
Yeah.
What are the difference between those two groups of people? I'm not sure. I don't know what the factors are that make some people, and also it's not necessarily one thing, maybe it's individual, but I'm still hoping that we can get people all the way better. I'm still hoping and I'm still working on it. And that's why I'm still trying to learn more.
If you're okay with me starting the conversation, how did you get into treating OCD and then RFERP?
Like, what's the backstory of how I came to RFERP?
Yeah, if you're open to that.
Yeah, so it's not one thing, but I think the simplest version of the story is that as somebody with OCD, after doing many treatments that were not helpful, like everybody else, I ended up doing ERP with someone who was truly excellent, like really, really good. And that was very helpful, but it did not fix the rumination.
Right.
And the person was good enough, like well trained enough to recognize that I was ruminating and to tell me that I needed to stop. But I had no idea what that meant or how to go about doing that.
Hmm.
And I would read, I have all of the workbooks from back then and the mindfulness and ACT and whatever other stuff was out there, but it really didn't help. Or it could help for like a minute at a time, but it didn't really solve the problem more generally. And then the big realization, part of it was I gave a talk at IOCDF with someone else. And in thinking through that process, what do we do for rumination and how do we teach people whatever? And then going to IOCDF and hearing from the experts on this topic
Yeah.
and recognize that they had no idea what they were talking about. Because I had sort of like everybody else assumed that the bigwigs had the answers. And then I went to these talks and I was like, oh, it's not just that I don't know what ERP does for rumination. It's that these people don't know. Meaning the emperor has no clothes. Like the wizard does not have any answer. Like
Yeah.
there is no answer. That's when things really kicked into gear for me. And I was like, it's not that I need to find the answer that exists out there. I need to figure this out myself. And I don't remember where it's at some point in that process, I had this realization that rumination was analytical thinking. In
Yeah.
other words, this realization that rumination was not a thought over and over and over again. It was you trying to figure something out. And the key thing is that analytical thinking is controllable and therefore rumination is controllable. In other words, people think that rumination is something that happens to them. And the key take home of RFERP is recognizing that rumination is actually something that you are doing. There are emotional factors that make you feel compelled to do it. You might not realize that you have a choice about doing it, but ultimately it is something that is subject to your control. And if you're ruminating, you can actually stop. Now, that requires teaching somebody how to stop. So first piece is recognizing that it is subject to your control, but then telling somebody you can stop ruminating, now stop, is in most cases not enough because they/we in the past literally do not know what that means.
Right.
When people with OCD, I always say this, if somebody says to someone with OCD, oh, I choose not to think about that. Like somebody without OCD will say something along the lines of, well, I choose not to think about that. The person with OCD, me historically, was like, what does that mean?
Right.
What are you talking? I don't know what it is. I didn't know what it is. That you can make a choice about whether or not you wanted to think about something.
Right.
And so trying to figure out how to do this for myself, trying to do it with patients, seeing where they were getting stuck, led to this algorithm that's on the website called How to Stop Ruminating. And basically it identifies that rumination is primarily trying to figure something out. And the primary intervention for stopping is that you need to make a choice to stop trying to solve this problem right now. But then it identifies 5 additional things that are stuck points that often come up and get people stuck when they're trying to stop figuring it out. So you can have somebody who's trying to stop figuring it out, but then they get stuck because their technique for doing that keeps them stuck. They're trying to disengage, but the way that they're trying to disengage actually includes an element of engagement. So just teaching people technique for sorting out those pieces to help them totally disengage from trying to solve this problem. So the first step was recognizing that rumination is analytical thinking, is subject to your control. The next part was developing this algorithm of what are all the possible stuck points so we can teach people how to stop ruminating, not just tell them that they can stop, but teach them how to stop. And then sort of the next big pillar of this approach is addressing justifications. Okay, now you know how to stop, but there's still a part of you that thinks that this is really important, and addressing knowledge that you see in ruminating. So helping a person to make the decision to stop once they know how. So
Yeah.
you asked how we got there. Probably it was out of personal necessity. Being someone who couldn't stop ruminating, knew I had to stop, didn't know what that meant or how to do it, didn't find any of the guidance that was available to be helpful. Having this key realization about analytical thinking and then trying that on for size with myself and with patients and collecting all of these different stuck places where people got stuck and then creating an exercise that could address them.
Yeah.
Yeah.
I love that actually because going into an IOCDF conference for any new fam joining us, that's the International OCD Foundation. If you're going into the conference and you're like, gosh, I'm struggling here, and the bigwigs, as you called them, don't have the answer, then oftentimes the brain goes, oh, there's not hope for me. And like, I'm the outlier here and I'm stuck. And I love that you were like, oh, you don't even know. Well, let's figure it out then. I love how that was, like, not a dead end, but, well, then I guess we need to keep brainstorming,
Uh,
right?
I think meaning pluses and minuses. I think there was an omnipotency there, like a sense that I'm going to figure this out and I can figure this out. We can figure this out. That was both a little bit omnipotent, meaning imagining that I have more control over something than I really do. But there was also something constructive about it, I think.
Yeah.
I grew up with a mom who was sick, and I grew up that we don't take no for an answer. So we just keep on looking for a solution. And there were downsides to that as well, but it certainly stuck with me in certain regards.
Yeah, so you were like, "This is how we function when we hit a roadblock. We just go
In a
and"
roadblock, we're like, no, no.
a roadblock, that doesn't yes. And I think it's inspiring for anybody because I'm sure we have the OCD family community going, so many people are hitting roadblocks. So many people don't even realize they're dealing with OCD and they've been to many different practitioners. And then they find out maybe 30 years in or much later, like, holy crap, this was OCD the whole time. And so you can see how just the lack of awareness across just even the treatment community outside of OCD, you can hit those roadblocks. And so I think it's a cool thing because not only are we going to learn more about rumination focused ERP today, but then we get to see how, yeah, I mean, it doesn't always come to fruition, but you and I were talking before we recorded of like, name it and claim it, like, put it out there. You know, you have a better chance of making steps towards that goal if you're like, that's the goal and I'm going to go there. And so I love that. So let's talk about what rumination is exactly. And also, because I certainly have heard clients bring this up, and I'm sure you have too, and you've talked a little bit about it and even in how you came to study rumination-focused ERP. But let's talk about what rumination is, and is it a compulsion? Is it an obsession? Sometimes people are like, but I think it's the obsession and the compulsion. And so can we start there and just kind of break down for folks, what do you mean when you say rumination?
Yeah. Okay. So I'll go in the same order as you did. Rumination, subjectively, is a person getting stuck thinking about something and they feel like they can't stop thinking about it. If we put it under a microscope, what we would find is somebody trying desperately to answer a question or solve a problem. In other words, somebody trying to figure it out.
Yeah.
What people who are ruminating don't realize is that the reason that their mind is
Exactly.
totally filled with this topic is because they are actively trying to answer this question. So people with OCD think I got a question from people sending questions by email sometimes. And I got a question from a woman that I thought really illustrated this mindset. She asked, so is the idea that if you stop engaging, eventually your mental loops will stop? And I thought that was a really good
Good.
example how people think about this in a misguided way.
Mhm.
In other words, she's imagining that the mental loops in her language and the engagement are two separate things. What she's realizing is that these things are the same thing. In other words, the constantly thinking about whatever it is, constantly thinking about being a pedophile is the same thing as constantly trying to figure out if you are a pedophile. In other words, those are the same exact thing. They're not separable.
Mhm.
And so if a person wants to not be thinking about this all the time, they have to stop thinking about this all the time. Does that make sense?
Yes, it
But
does.
and you can't sort of keep trying to figure this out while also trying to stop thinking about this, because again, these are the literal same thought process. So that is what ruminating is.
Can I ask, Michael? I think an analogy sometimes, and I'm almost imagining like a Reddit post where we keep clicking up and you're like, but I don't want that to be there. But we keep kind of clicking up and bringing the relevancy to the top of our mind.
Yeah, that's a good example. When you put it into physical terms, I think it makes it clearer. Yeah, it's exactly like if somebody is Googling and Googling and Googling, but says, I don't want to be focused on this thing, but they're also Googling, right?
Right.
So that it's like that, except it's all happening in your mind. And so it's easier to not realize what's happening, especially when the language that the field has used to talk about this for years is language that communicates that this is something that's happening to you and doesn't wreck intrusive thoughts or OCD brain or, externalizing OCD. All these things sort of communicate that this is something that is happening to you and don't identify or name that this is something that you're doing, whether or not you recognize it, whether or not you know how to stop, whether or not you feel terrified, it is still something ultimately that you're doing.
Yeah.
I want to say one thing before going any further, which is, but what is the obsession? What is the compulsion? I would say the whole thought process is compulsion and is subject to your control. The existence of the question, the fact that this question exists, that you worry that you're a pedophile and that you don't, that is something that haunts you, the existence of that question, that is the obsession. Any engagement with that
It's the compulsion.
is the compulsion. So I used to use the analogy during COVID that the fact that it's a pandemic, that we are in a pandemic is the obsession, right? The fact that we don't know when it will end, the questions we have about what's next and what the world will look like.
Right.
It's a bit of a throwback at this point, fortunately, but
Thankfully. Yeah.
that question that exists that haunts you is the question. Any engagement with that, trying to figure out when it will end, trying to figure out whatever it might be, trying to figure out all the things, what we should do about it, et cetera, that is the compulsion.
Yeah. And it's an interesting way to think about it because I was thinking about like in the example of Googling. And I try to kind of think about these in these ways too, because I think the fam is like, oh, yeah, that makes sense. Like if you're choosing, like no one is going in for you and putting in the search criteria, right? You're typing it in. And so if you're typing in and Googling these different things, and then you're doing something completely separate, say you're on Amazon, say you're somewhere else, and your ads are now targeting, hey, you're really into this topic, we're going to suggest this to you, then you might be like, I can't escape from it, right? But you realize actually the reason I'm being served some of these ads is because I've been Googling it and the algorithm's picking up. You have interest in this. Maybe you would like that,
I
right?
love that. I will say, I love that. I think that's a great, amazing analogy. It leaves out more the deeper level, the psychodynamic level, like why is this preoccupying you in the first place, which might lead to this popping up for you also. But on a cognitive behavioral level, I really like that. I think there's a lot of truth to that like, yeah, if you're constantly thinking about this, constantly thinking you're going to see it here and there and everywhere.
Yeah. We are definitely going to address that deeper level because I think this is one area where ERP, and again, for any new fam joining us, ERP is exposure and response prevention. It's a treatment for OCD. And ERP will say, we don't need to go any deeper than that. If we stop the compulsion, so response prevention, if we prevent ourselves from responding to the intrusive thought, image, sound, whatever it may be, then we will teach new learning in the brain and this will resolve the issue. And it doesn't go deeper than that. And so I like that you're clarifying it because honestly, before I started treating OCD, I was more of a psychodynamic therapist, which is almost a dirty word in the CBT community, right?
Frequently.
Yeah. And so you're speaking to, well, if we're looking at the preoccupation, and yes, because the piece I was speaking to, fam, is if we're doing that action, like you said, that you're actually choosing to engage with this content. And this is also leading to feeling stuck in the rumination, but we chose that. There still is an important piece to address underlying that, which is why did I come up with this being such an important thing that it might say something about me? And so if we can speak to that, I know in just reading through and learning and preparing for today, I know some of the talk was about learning about what rumination is, but also understanding, okay, the awareness, like you said with the pandemic, the awareness is something we don't have control about. Where we direct our attention, almost like that spotlight that we can put focus on what we're going to just really think about, that we do have control over. And so part of what we're going to be talking about in talking about rumination-focused ERP is that, but also that underlying piece of how did we get preoccupied here in the first place?
To summarize what you're saying there's the element of the conscious part that we have control over, that this is where we're directing our attention and that contributes to our preoccupation with it, and that we can make decisions about where we direct our attention. And then that there's this other unconscious or emotional piece, which is there is some reason that this is where our attention is drawn.
Yeah. Yes, that was a really good way of summarizing. So thank you for that. So, as we start thinking about, we can't necessarily control thoughts that are going to pop into our head, but we do have control on the response that we have to it or the engagement that we choose to create with it, like you said with the pandemic. Would love to kind of think about just the different steps, and I have some notes here. And so, one of the first steps that you recommend, and if I get any of this wrong, please help realign me. But one of the first steps is you talk about don't ruminate. And we talked about this a little bit before, but sometimes it's hard because folks with OCD are going to be going, but I'm trying to not ruminate. Like I can't not think
Right.
about it, right?
And I do not think that that's enough. That's the starting point. The idea is don't ruminate. In therapy, if you're doing this exercise, you don't ruminate. And then you look at what happens for you when you're trying not to ruminate. And then you go through the multiple choice and you say, okay, which of these was I having an issue with? And then there's a little blurb for, okay, now how do I deal with each of these stuck points? So it's like, it's not just don't ruminate. And then if you can't do that, it's your fault. No, don't ruminate. And then let's take a look at where you're getting stuck. And then let's address each of those stuck points individually until we've shown you how to stop ruminating.
Right. And one of the points that you referenced a little bit earlier that is huge in this is that solving compulsion. Like people are out there to solve the problem because OCD does gaslight to say, if you could just solve this, you'd feel better. Right. But
Yeah.
but the solving only brings about more questions, that process, that compulsion. And so for folks listening going, dude, if I could not try to solve shit in my head, like that
Mhm.
would be awesome. Sign me up, but I can't stop myself from doing that. And so if that is your stuck point where you're like, but I can't seem to stop from the solving. Tell
Mhm.
us what you would do next in that scenario.
I think you can break down the approach into addressing technique, addressing justifications, and then addressing underlying emotional factors. So if you want, you could organize that as behavioral, cognitive, or metacognitive, and then psychodynamic. So first, behavioral. First, the person needs to know how to stop ruminating. Unless the person actually knows how to do it, talking about any other factors is kind of irrelevant. You literally do not know how to do something,
Yeah.
it's irrelevant to talk about making a decision to do it. So first we do technique. That's the how to stop paying attention exercise on the website. We teach people how to disengage. When people say, I choose not to think about it, what does that mean? How do you do that? So we teach people how to do that. That's number one. And for a lot of people with OCD, that's like really like a life-changing skill that they
Right.
literally never known how to do. Personally, that was something I literally did not know how to do. Now I know exactly what that means and I can do it. But that is not enough. That's step one. So
Right.
now a person knows how to do it, but then they're conflicted. Like you said, they might feel like, they might think, I'm never going to feel better until I figure this out. Or they might think I really have to figure this out or something bad will happen or whatever it might be. There's a value that they assign to figuring it out.
Yeah. Value.
What you want to do is we want to elicit that value or that justification for rumination. Tell me the value that this has. And then we want to challenge that. And we want to look at starting with the premise that it's either in or out, that you can't have it both ways. You can't be trying to figure this out and also trying to not be thinking about this all the time. You can't be thinking about this all the time and also wishing to not be thinking about this all the time. We're going to help you to sort out your conflict about doing this and make a decision that you're either doing it or not doing it.
Right.
Right. So that's number two, addressing justifications. Okay.
Yeah.
That's on the cognitive behavioral level. On a conscious level, you have control over this. Let's sort out your thinking about it. Let's make a decision to do a certain behavior. That's on the cognitive behavioral conscious level.
Yeah.
Then number three is addressing, to me, the majority of the picture, which is what is this really about? What's going on emotionally? What was the context in which you found yourself ruminating? What purpose is that serving for you? Were there feelings that were really threatening here? Were there things going on that you weren't even conscious of, that you weren't even looking at, that the rumination was distracting you from, in a defensive way, like protecting you from looking at everything else that was going on here? So in other words, what are the emotional and relational factors that are driving the rumination? So you can control this, but there are also forces that are compelling you towards it. And we can make it easier by attenuating those forces also. So there's like the above ground and the below ground. We're like cleaning things up above ground. And then we're also trying to look at like the underlying causes. What is going on here that you're not aware of? And for anybody who hears that and thinks I'm saying something threatening, like, oh, there's something, dark and secret that you're not aware of. As always, I want to clarify that is not at all what we're talking about. We're talking about natural, healthy, normal feelings that for this individual are conflicted for some reason. Like, for example, somebody who, just as a really, really easy example, somebody who feels really conflicted about being angry with someone they love,
Hmm.
like a normal, healthy feeling, or somebody who doesn't want to acknowledge, feels guilty about separating or having autonomy,
Hmm.
right? Just a natural impulse toward that, then maybe for them growing up was not okay. Or maybe whatever it might be, or I could give a million examples in this department, but all of the emotional, relational factors that are behind the scenes.
Yeah, I mean, it makes sense to me. And what I will say, fam, is I was talking with Michael before we recorded about ICBT,
Mhm.
inference-based CBT, and to me, it reminds me of some of the logic that goes into how we formulated this. Right? I have personal experience, like you're saying, things that happened in the past that really contributed to the cauldron of different complex feelings I might have around this, and so it is important to be able to look at what's happening on the surface, right? Or above ground, like you said, and also to till in and to again bring in another analogy because my husband and I we're getting into planting season. What I make it sound like we're farmers. We put some tomato plants in the yard, but it's you have some work to do. It's not just put the seed in and it all grows. You have to look at what's going on at the soil underneath, and that's going to inform you. If it's full of
Mhm.
weeds, that's going to be a rougher growing environment than if you
Mhm.
have nice topsoil, if you have clean soil that is devoid of some of that thistle and different debris.
Fun.
And
Yeah.
yeah, so I like that, and I think that makes a lot of sense. Also, I'll say, fam, the way the keyboard warriors here for our OCD fam probably jumped over to your website going, "You have a behavioral list on how to stop ruminating?" I'm sure people are jumping over there. I'll remind people that I always have links and citations and resources to everything we talk about over on this episode's blog at ocdfamilypodcast.com. So I will have the link to Michael's website, and you can jump over there and check it out for sure. But please don't lose this point, fam. Just what Michael was just saying. It's not just the behavioral piece. So if we're only focusing on let me knock out the behavioral piece and now I'm not going to ruminate and that'll solve everything. And again, the clue there is solving it, right? There's more to it than that. You got to look at more than just those behavioral pieces.
We don't want to understate, just to sort of underscore what you're saying, we don't want to understate either side. Like the CBT part and the how to stop ruminating and learning how to do that is so important. And I get emails from people on the regular saying they use that part of the website, they learned how to stop ruminating, and that it has made a tremendous difference for them. So just the cognitive behavioral pieces can be profoundly helpful. And they are not the whole picture. OCD is an emotional disorder. It comes from somewhere. It's about emotional conflict. It develops in the context of emotional and relational experiences. And just addressing it on a behavioral level, like Nicole, like you were saying, is like just shoving the tomato plant in the soil, or it's just like mowing the lawn without any attention to like what's planted here, or what's going on beneath the surface. Or you know what? Here's another metaphor if you wish. It's like if you have a sailboat on the water,
Yes, bring it. I'm here for the metaphor.
right? So if the sea gets rocky, like CBT is like adjusting the sails to like figure out how to manage your boat on those rocky waters. And that's tremendously important. But then the psychodynamic piece is like looking at what is making these waters so rocky. Where is the
Exactly.
turbulence coming from? Right. So
Yes.
you can develop the skills to fix the boat, to manage it, whatever. And that can be, I mean, that's really important. Otherwise, you're going to drown. Really important. But where is all of this turbulence coming from?
Yeah, and to that point, Michael, and this is what I find myself thinking about even when I'm thinking about ICBT, but to that point, it sounds like you would agree for RF ERP, while it's important to know how to navigate the choppy waters, we would love for you to not always have to be feeling like I am surfing these choppy waters, right? Like it's one thing to know how to respond and react, but it's like we would love some calm for ourselves. We would love less choppiness. And sometimes we can't control factors, but sometimes we can. We can make an impact on how choppy we are experiencing all of this to be. And part of what you talk about in RFERP and also goes to this point, and you talked about OCD being an emotional disorder, is that what we see is anxiety is the byproduct. Anxiety is coming after the rumination. It's coming after and part of the way we know we're still engaged in rumination even is we can say, is the anxiety still there? Is it still high? Well, then we can usually point to there's some of this still going on, right?
And I'll jump in on that. So that's how I used to talk about it. And I I don't I don't fully agree with that anymore because I think both are true. I think if you're anxious, you're ruminating. But I think the way I talk about it now is it's more accurate to talk about it as if you have ongoing anxiety. Rumination perpetuates anxiety. So that something happened and triggered you and you felt anxious in that moment. I don't think that that's because you're ruminating. Sometimes it is. Sometimes it's because you were Googling and then you started getting the Amazon ads. So sometimes it's at least partially related to the fact that you've been ruminating, but sometimes like that's sort of just the unconscious. There is some reason that this triggers you. And then if you respond to that moment of anxiety or fear, maybe, I'm not sure how to describe that, but if you respond to that initial moment with engaging and trying to
Engagement.
figure it out, etc., that's a defense that perpetuates the anxiety. So if you have ongoing anxiety, I would say that indicates that you're ruminating, that you're mentally engaged with this. But I wouldn't go as far as I used to and say that therefore all anxiety is caused by rumination. Because that initial moment and the fact that this is an issue to begin with, that I cannot attribute just to ruminating. Does that make sense as
It
a clarification?
it does, and again, like my default is just what I've had, for lack of a better word, exposure to. But my default is categorizing it in that reasonable doubt versus obsessional doubt, because we can see how, yeah, if something happened and you have a spike in anxiety and you're like, wow, that just happened, and yeah, I'm having that response. That's hard, but if it continues and perseverates because we're engaging with it, then we can see how that's functioning more obsessionally and we're really can be stuck in that thought. It's kind of how I hear that similarly, and it might be different. I don't
No,
know.
okay. If that's how you think about it from an ICBT perspective. And we talked about ICBT for a very long time before we started recording. And there is definitely a lot of overlap between these approaches and definitely a lot of room to integrate them.
Yes.
So there's a lot of similarity and a lot of overlap.
Yeah. Yeah. So I appreciate the clarification then on anxiety. So that persisting anxiety, that prolonged anxiety would be more of a response of rumination. That shorter burst could be, but isn't always functioning that way, if I'm hearing you correctly.
Exactly. So something happens that makes my stomach drop, right? That like hits that nerve.
Yeah.
I wouldn't say that means eliminating. But then do you move on? Do you make a choice to move on from that feeling? That sucks, but we're not engaging.
Yeah.
Or do you launch into, okay, why did I feel that? What does that mean? I need to figure this out, et cetera, engagement. Then that's going to perpetuate the anxiety.
In juxtaposition to the solving compulsion, another thing that you've talked about in your work, and we talk about in the broader OCD field as well, is as how it's not helpful in turn. Instead of solving, it's also not helpful to then just avoid it with all get out, right? Or pretend it never existed in the first place. Because avoidance also isn't going to lead us to that freedom. And sometimes I think people do conceptualize, if I'm not ruminating, then I'm avoiding thinking about it. So, what would you say about avoidance and rumination?
That's interesting. I've not actually encountered that question, but what you're asking is, could somebody think that not ruminating, not doing that compulsion is avoiding?
Yeah.
So I would say Avoiding is when there is something that you want to be able to do that you feel like you can't do or that you won't do because it's going to elicit anxiety. That's avoidance.
Hmm.
Not doing something that makes you upset is not an avoidance. I can see how if you, okay, so this, I guess actually in the background here is like the old, I don't know, not old for everyone, the traditional ERP approach, which is that you're actually supposed to make yourself anxious on purpose.
Hmm.
According to that, anything that would attenuate your anxiety could be seen as compulsive. I don't endorse that approach at all. I think it is guiding. I
Hmm.
think it's the sort of confusing places. And so I can understand how somebody with that approach might think that if ruminating makes you anxious, then that might mean that you should ruminate because you want to be anxious, because you want to habituate to the anxiety. But I believe personally that ongoing anxiety is a consequence and an indicator of rumination, and that therefore habituation has nothing to do with it.
Yeah.
Because as long as you are ruminating, you're going to feel anxious, you're never going to habituate, and the anxiety is only going to go away when you stop that mental engagement.
Yeah.
So it's sort of like if somebody were eating something that was hurting their stomach, you wouldn't say, keep eating it. And so you'll habituate to the feeling of pain in your stomach. You would say, stop eating it. That's how you make your stomach feel better. So that sort of is a good metaphor for the difference between how I see anxiety and how the traditional approach sees it. The traditional approach says you want to habituate to this feeling. And I say, no, you want to stop doing the thing that is causing this feeling.
Yeah, yeah. Although it's funny because I just did this episode with Dr. Melissa Hunt where she was talking about, well, sometimes our body loses the ability to do things like breaking down lactase because we stop doing it. And so actually exposure is the way that our body starts to produce the ability to break it down again. And so she, in specific different ways, not just broadly, would be like, you should keep eating it. But unless the
Can I
doctor said no, yeah,
Can I pause for clarification? I
okay,
still believe in exposure. The question is, what are you exposing it to?
right,
In traditional ERP, potentially you're exposing to something because it causes anxiety and you want to habituate to the anxiety.
fair.
In our ERP, you still do exposure.
Yeah.
It's not with the goal of feeling anxious and habituating. It's with the goal of restoring agency and being able to do the things that I want to do and
Yeah.
being able to confront triggers while knowing that I don't have to do the compulsions that I historically have done. So we still do exposure. There's just a different framework for thinking about what we're doing as exposure and why we're doing it as
Yeah,
exposure.
the goal, the overall goal too. One of the clients I was thinking of when I was asking that question initially, because it brought us into a broader conversation about what's egosyntonic and what's ego dystonic. And like you
Mhm.
said, if you're wanting to do something, if it's in line with your values and for new family joining us,
I'm so sorry to interrupt, but I need to differentiate between those two things. Something being ego-syntonic does not have to mean that it's aligned with your values.
oh,
For example, it could be ego-syntonic that I need to take a break. I need to rest. I need to watch some TV. That could be ego-syntonic. That's what I actually really want. And it could be misaligned with my values. My value could be that I should be working right now. I should be X, Y, or Z. So I don't like to bring values into OCD because I
fair.
think values are like more, if we want to use some old language, like values are more like superego, what I think I should be doing, moralization. It's intellectual, it's moralistic. Egocentric is about my actual sense of what I want.
Well, what was interesting about what the client said, so even taking that verbiage out of it, one particular client was talking about the avoidance and rumination. And you're saying, well, you wouldn't want to avoid it if it's something you naturally want to engage in, right? These other things are things you don't want to engage in, but the engagement in the thought process is part of what's making it stick there. And so one of the things that they brought up that was particularly interesting, and maybe this speaks to the broader point of what you were just distinguishing about egosyntonic. The person said, but it is of my value to make sure everyone is safe from X, Y, and Z concern. So I have
Mm.
this debate with my partner all the time, and they're like, this isn't your value. Why are we focusing on this? And it's like, because actually it is. I'm trying to keep everybody safe. And so they were talking about too in this connection of is avoidance then the answer? This is how I stop ruminating is I avoid all things that could engage my brain in that way. And the greater thing that this will lead us towards is just understanding that relationship as you were defining it and the usefulness or lack thereof in conceptualizing it this way as we kind of approach ruminations and really how they're functioning.
So for that person, the questions that I would be asking are, well, so first of all, she talked about avoiding something because she feels like when she confronts it, she can't rein in her mental process. So that exactly speaks to the way that RFERP conceptualizes exposure. So for that woman, we would want to do exposure to those triggers while helping her to maintain control of her rumination. So she can confront the triggers without falling into rumination.
Hmm.
Then she can learn that she can confront these triggers without losing control. Does that make sense?
Yeah.
And so that would be the purpose of the exposure would be to restore her sense of agency that she can do these things and she can do them without ruminating and without feeling significant anxiety. So that would be exactly the purpose of our exposure. But in terms of helping her to sort out, where is the line between what you want to do and what you don't want to do, that would be the conversation. So let's say overall, it's really important to keep your whatever, I don't know what the context is, your kids safe. Is that the context?
Yeah.
Yeah. So for sure, that's your value. But then even within that, you're going to have some felt sense of what feels like something that actually makes sense to me that I actually want to do.
Hmm.
That does make sense to me that I do X, Y, and Z. And then we're going to cross a line somewhere that you might not even be aware of, but can help you become aware of when you're doing things that feel excessive to you, when you're doing things that feel like I don't want to be doing these things, but what if I don't do them and then something bad happens and it's my fault, et cetera, whatever.
Yeah.
But that cross a line from what actually is egosyntonic, meaning this actually makes sense to me. I actually want to be doing these things into I don't want to be doing these things, but I feel like I don't have a choice. I will give you one example that's not exactly relevant, but one time years ago, a patient was knitting a scarf for me. And I love this example because there was a period of time when that was something really that felt really exciting and good to her. And
Hmm.
she was excited to be knitting the scarf for me. And then there came a time when she really wanted to be done, but she felt like the scarf wasn't long enough and she was forcing herself to keep on going, but she really didn't want to.
Right.
And the reason I love this example is because objectively, externally, there was no difference in the behavior. If you look, we're watching this person, we would just see somebody who is knitting a scarf the whole time.
Hmm.
But internally, subjectively, a line was crossed from something that I want to be doing to something that I feel like I have to be doing, even though I don't want to.
Right.
And so we're looking to help people sort out where that line is.
Yeah, no, I think that's a really great example. And it really speaks to, because what I will say is most people with OCD, I can say this was true for me, and most people will report this, especially if they go and share about their diagnosis with people. They go, look, I don't think you're OCD. I've never seen you do that. I've never,
Mhm.
because people have this conceptualization, a very wrong number of conceptualizations about what OCD actually is, about preference and order, etc. And while order can show up, it's usually attached to these very distressed meanings of if this isn't an order, something dot, 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 fill in the blank. And so it's very interesting when you think about it and you say, yeah, I could look at somebody and it just looks like they're knitting the scarf. That's all I can see. But inside and internally, and this is where people get caught up. I've heard patients say, I'm sure you have as well, if it was as simple as don't touch the doorknob, great. I can't shut off my brain. I cannot touch a doorknob. And that's saying a lot because anybody listening that has contamination fears around doorknobs, that's not a small thing, right? So we're not trying to take away the value and the strength that it takes working on those different compulsions. But when you can't detach yourself from your brain, or the feeling is I must detach myself from your brain, and we're shifting and posturing that to actually we're choosing and engaging with the thought, and that's what is making it stuck. We can teach ourselves not to compulse. We can teach ourselves not to ruminate. That's profoundly different. But at surface level, me or you looking at each other, we wouldn't know. Right? Just like we wouldn't know looking at the woman knitting the scarf that she was experiencing those two very, very different. I so like might want to go into value driven language here, but
The reason I don't like value driven language, because what if her value was what maybe she would say, what's your value? The value is I want to make this scarf. Like the value is I should make a nice scarf. Or my value is I should do it the right way or don't do it at all. That's my value. Okay. I mean, that's not helpful, right? Or my value is that I should, I don't know. You get what I'm saying.
I
The
do.
value. Yeah. I think values actually don't belong in, I can understand the value, in teaching someone you have all these symptoms, but let's still try to focus on how you want to live your life. But I think that specifically for OCD, starting to talk about values is really,
Can muddy the waters.
yeah, dangerous territory for people who have spent their whole lives really listening to what they should do, their sense of what they should do or what other people want from them versus paying attention to their actual feelings and what they actually want. So anyway, that's a sidebar, but one of my, yes,
One of those topics that you like to be able to educate on if it comes up.
if
Yes.
it comes up, I think it's important. Yeah.
Yeah, no, I think it's
You would stay away from values and OCD treatment.
and to the point, if we were to scale the language back to how you originally postured it, when you were talking about what is avoidance or what isn't it, then even for the woman with the scarf, if she didn't want to do it, then how does she not do it? How does she not engage with doing it if she has decided, I don't want to do it?
Two separate pieces, right? Actually, here's the word that I'd prefer over values: authentic. What's the authentic self? What do you authentically want to do? What's authentic to you?
Yeah,
That's what I'd be looking for somebody with OCD. Rather than navigating towards values, I would want to navigate toward authenticity and the authentic self over what in the psychoanalytic world we might call the false self.
yeah, yeah.
And in terms of then sorting out now, how do you do that? That's sort of a separate piece.
Right. Right. Well, and so in the process, and again, fam, I'm going to have the link to Michael's website where you can check out the process of how do we actually do that behavioral piece of stopping the rumination. And one of the things that I found when researching for our talk today, how useful being able to do this SUD scale. So if I scale from 1 to 10, where my anxiety is, which we love to get into anyway with ERP, but it's just giving us some language. It stands for subjective units of distress. And it's just giving us a ballpark of how distressed am I feeling? How anxious am I feeling? And so some of the things that, and again, you correct me if my read on this is wrong, but we were able to look at different aspects of even when we're rating an anxiety, what does that mean? Well, sometimes it can mean you're still trying to figure something out and you're still trying to solve something.
To me, that's always what it means.
All right. So that is the main cheese right there, guys. Other things too that I saw, and tell me if this fits, maybe this even falls under that, is it can be a result of us trying to direct our attention and really scanning, checking, and monitoring our thoughts and emotions and feelings. So while we are trying to not ruminate, we've now started this process of, am I not ruminating? I'm scanning for it, and I'm thinking about it, and looking for that kind of evidence sometimes can reinforce and raise the anxiety.
So two pieces here. One is how do we use sun scores in RFERP? And the other is where does attention fit in rumination?
Yeah.
So taking those in order. So RFERP uses SUDS, but in a completely different way from traditional ERP. So they have a role to play, but it's a different role. So in traditional ERP, you would use SUDS to gauge whether a person is habituating to their anxiety, which again, I don't believe in habituating to anxiety. So I believe that when people seem to be habituating, it means that they have stopped ruminating and stopped engaging. But putting that to the side, that's how they would be used in traditional ERP, not RFERP. In RFERP, we use SUDS to indicate that someone is ruminating. They indicate mental engagement with the issue. And so we use them when we're teaching people how to stop ruminating, we use them as a gauge of what's going on for them, whether they're still engaging, whether they're still ruminating. And we're trying to bring that down to 0. And 0 is an indicator that they've stopped ruminating. So it's not about lowering that number. That number is just like a litmus test, is an indicator of what's going on cognitively. So we're using it to gauge rumination.
Okay, so it's like a pH balance then of like you're seeing the acidity or not, right?
Exactly. You're not trying to bring down your anxiety. That's not the goal. In RFERP, we're not actively trying to change our feelings. What we're doing is we're changing our mental activity. We're changing our cognitive activity. That's where we're exerting control.
Yeah.
And how we're using the anxiety level to gauge as a litmus test, like you said, a pH balance to gauge what's going on cognitively. Is this person actually disengaging cognitively? Because if they're totally disengaged cognitively, we're going to see their anxiety level go down to zero.
Yeah. Well, what I will say too is when I was researching it was like, this is a very different take on sets. But because we think about like, okay, anxiety being a byproduct, and if you've done before hearing this conversation, if you've done any kind of history of ERP, then that's where your mind's going to go to with sets. And so
Mhm.
that is a very different way of literally like,
Sure.
you're not going to find that rating if it's not running, if that system's not running, if it's not going, you're not gonna find that SUDS score being higher because it's really connected to the different mechanisms happening within the rumination, right?
Yes. There's a lot more similar across ERP and RFERP than there is different. There's a lot more similarity. We're all doing exposures, we're all doing response prevention, et cetera, et cetera. This is where like the center of the difference, the key difference is traditional ERP is trying to raise anxiety to maximize anxiety during exposure. And RFERP is trying to minimize anxiety during an exposure, not just because we're trying to be nice, but because in our book, anxiety is an indicator of compulsion. Anxiety is an indicator of rumination, of mental engagement. And so we're trying to minimize it because that's an indicator that there's no compulsion going on. So there's an article on the website, which if you want, you can link called RFERP Turning Exposure on Its Head. And it sort of zooms in on this key difference between traditional ERP and rumination-focused ERP, which is maximizing versus minimizing anxiety and why we're doing that. So that's an answer to that question that you were asking. And then the second thing you brought up was the role of attention
Mhm.
in rumination. And so that's an important question. Basically, most of the time when somebody's ruminating, they're trying to figure something out. But you can have somebody who is not exactly analyzing, they're not exactly trying to figure something out, but what they are still doing is directing attention towards the problem.
Right, right, right.
So the broader construct of rumination would be any engagement, any directing attention to sort of the bigger picture, directing attention towards the problem is rumination. And oftentimes going even further than that and actively trying to figure it out. But the key piece is the directing attention. Does that make sense?
It does, it does. I'm just thinking too, because I'm looking at the website right now, and I love that you do this. There's a lot of kind of vignette examples of what this might look like in a case. And I'm realizing even as I was reading through some of it and prepping for our conversation today, I was still thinking about it in such an ERP mindset that it's like, let's do this again, but without ruminating. And again, there's different pieces to it, and folks can find out about the different behavioral strategies of stopping that rumination. But it read very much to me because that was my context of we're lowering that anxiety. Now, kind of thinking about it in terms of that litmus test of that pH balance, it is very different. And realizing, like you said, if we're putting attention even to different elements of it, we're still engaging in that. And so, literally, what we're trying to find is where we stop the engagement. And most people, if you've done ERP before, whether you've done treatment or not, and you're realizing OCD is on the scene, it feels like the natural solution, not to solve or anything, but the natural solution here would be lower that anxiety, right? Like I just need to lower that anxiety. But this is saying if you're not ruminating, that anxiety isn't going to be spiking. So it wouldn't be reading pertaining to that particular thought. You might have some other anxiety in life, but is that, am I understanding that correctly?
Yeah. Like basically, traditional ERP is focused on the idea of habituation and the idea that you can habituate to anxiety and that the goal of exposure is habituation. And RFERP thinks of anxiety as a consequence of rumination.
Yeah.
And because it's the consequence of a behavior, habituation becomes irrelevant. If you have something that's the result of a behavior, then the way you manage it is by stopping the
Behavior.
behavior,
Right.
not by continuing the behavior and trying to habituate to it. So that's one of the key differences. There are other key differences also, but that's the key difference.
Let me ask you this with respect to disgust based themes, because we know in OCD, distress can show up as anxiety, and that is a biggie. But there can also be disgust. Do you find, because just from my observations, and I've started learning about also a new approach called the mastery approach to address this disgust. But does it respond? Because I don't feel like disgust does respond to that traditional ERP.
Yeah. Okay. So a couple of things. First of all, correct, like feel free to email me, tell me this is not right, but I don't think discuss based OCD the way that other people do.
Okay.
I think that what people are thinking of as disgust based is really a fear of getting stuck in the feeling of disgust forever. So, for example, two types of contamination cases. One is that I'm afraid that I will contaminate this thing and then it'll lead to some bad external consequence, whatever that might be. For example, harm to a loved one or to me, whatever.
Mhm.
And then you can have another type of contamination case where the person says, I don't fear anything happening. What I'm afraid of is that this feeling of things being contaminated will never go away.
Right.
That is, I think, what people are talking about as disgust based OCD. And for that person, and this is where RFERP can be a really, really powerful intervention that is very different from regular ERP. For those people, what we need to show them is that rumination, specifically keeping track of what is and what is not contaminated, is what generates and perpetuates the subjective feeling of contamination or disgust. And therefore, by not ruminating or not keeping track of what is and is not contaminated, you can make that feeling go away.
Right.
I think for people who have OCD, where they have an urge to do something a certain way, like to move their hand just right OCD, for example, sometimes that person might have a fear of what will happen if they don't do that. But often there is no feared consequence other than this urge, and the distressing feeling that goes with the urge will not go away until I do the compulsion. And so for those people too, what we want to show them is that ruminating about the urge and specifically debating, am I going to do it? Am I not going to do it? Is what perpetuates the urge.
Yeah.
And we can, by disengaging from that debate, we can make that feeling go away. So what we want to show these people is that there is another way out of that feeling. These people are afraid of getting stuck in that feeling, and we're showing them that there's another way out. And therefore, RFERP is a specifically powerful intervention for those types of cases. But in my book, they're not disgust based. They're still fear based, but the fear is getting stuck in that feeling.
The fear of being in the disgusted zone.
And whenever that might be that feeling, I don't think it's always disgust. I think that that's sort of like people latch on to the vocabulary that is closest to their experience. So people often probably are just talking about a subjective sense of contamination, but they don't have other language for talking about it. So they're like, oh, it's disgust based. The way I would say it is, it's just the feeling itself. It's the feeling itself of contamination. It's the feeling itself of the urge. And I say that as someone who knows exactly what a disgust response is, because I have trypophobia, which is not really a phobia. It's a disgust reaction to holes. Okay.
Mhm.
Like, I'm not scared of holes. I'm not anxious of them. But when I see like the lotus,
Yeah.
I am immediately nauseous. And I'm not scared or anxious. It's disgust. I have never met somebody with OCD who's having that reaction. I could be wrong. Again, email me. But I have not met the patient for whom that is the issue in OCD. It's more like this is contaminated, this is not contaminated, et cetera, et cetera. That feeling of everything is contaminated.
That fear, that feeling forever. So another question that just bubbled up for me then is, I was talking during my OCD related disorder series earlier this year about misophonia. Because misophonia gives me that similar vibe. I'm wondering, could we say, is it the fear of I'm always going to have this response to certain sounds?
I think that, okay, misophonia, I'm glad you brought this up. It's like one of my pet topics. I think misophonia, which for those listening, it's not misophobia, it's misophonia, like iPhone. with OCD, I think is actually misleading. And I think that misophonia is not about anxiety, it's about rage. Misophonia is not about anxiety. Misophonia is about, I'm going to kill you if you keep chewing. And so I think of them differently. And I think that they sometimes live in the same people for different reasons. My understanding of misophonia, and again, the experts, if I'm wrong or you have it or whatever, email me. But so I'm open to being wrong. But my understanding of it based on the clinical experience that I have is that, you know how in DBT or just in life, if invalidation leads to dysregulation,
Yeah.
like if you invalidate a feeling, then that feeling becomes unmanageable. Whereas if you validate it, it becomes manageable and containable. And that's how we learn to regulate our feelings.
Yeah.
No, I shouldn't give DBT credit for that. That's psychoanalysis, but DBT has packaged it and people have learned it. So anyway, to me, misophonia is about a feeling of my boundaries being violated. Like you're chewing and it's like encroaching on me and I can't get away from it and interacting with it. And my reaction to that is unreasonable. So I'm not allowed to hate the way your chewing sounds, or I am being crazy. I am being dramatic. I am being whatever it is. And so I can't validate my feeling of feeling intruded on or encroached on by your chewing because that feeling is not valid or will historically people have reacted to it by saying, I'm crazy, I'm controlling, I'm dramatic, whatever it is, shaming me and validating that reaction I have to your chewing. And so that feeling of hating the sound, it's so deeply invalidated. It's so deeply linked with that invalidation that the second I hear you chewing and it makes me upset, I'm immediately like enraged, dysregulated because I hate it and I'm not allowed to hate it.
Mm.
That's how I think of misophonia. Like I think it's often in situations where people in other ways in whatever relationships feel like their boundaries are violated. And I think it comes to capture that feeling of having your boundaries violated, of having someone intrude on you and you not be allowed to react to it, or else you're being unreasonable. Sync misophonia, that's my theory. Again, people feel free to email me if you think I'm totally off base. My theory is that misophonia captures for people who are in relationships or families where they feel intruded on, encroached on, violated, it captures those feelings, but then it's dysregulated and it's extreme because it is so deeply automatically invalidated. Yeah.
Well, and I will say people too then can develop these self-narratives of not only feeling that invalidation in the moment, but because of the feedback they get or the shame they feel about it, then it's like, man, I just feel like I could go at any minute. I don't know when I'm going to explode. And there can start to be some rumination about, am I going to experience a trigger or not? Some part of it, what I would put in kind of that normal doubt category. But I think, especially if it is commingling in somebody with OCD, we could probably see it functioning more obsessionally.
Have you experienced people with misophonia having anxiety about it? I've experienced people just like it's miserable because they're stuck with this enraging experience.
Yeah, so I'll give you an example. I had a client with misophonia, and it was definitely rage in the moment. It was definitely to the point that like once broke a bone because their response was so intense. And I won't get into details for confidentiality, but what I will just say is it's escalated a lot. But there was in the narrative afterwards, this broader story, this piece of, am I going to lose my spouse because they think I can't keep my shit together? Because I end up having these explosive responses. And so that's where I would say some more of the anxiety would come in, would be about what is this going to mean for me in my life if I continue to struggle with this around things that I'm not going to be able to eliminate encountering in life, right? I'm going to encounter it whether I want to or not. And
So
so,
for this person, you got tied into their anxiety.
yeah,
And obviously, for anybody psychodynamic listening to this, we're thinking this is a story about how in this person's family of origin, when they got upset, they were shamed and blamed and invalidated, etc. and it was a threat to their relationships.
It's also a piece, though, with a partner being like, "You gotta knock this shit off or I am done," kind of thing. So,
Yeah.
I would say both. It was the I feel like my marriage is on the line, but also yes.
Basis in their current relationship, in other words.
Yeah.
That's sad. Yeah. So that's a good example of how it can get tied into anxiety ultimately. But I think that at core, misophonia is not about anxiety.
Right.
Misophonia is about rage. And I think that similarly, trypophobia, and Dean McKay is like an expert on this, and I spoke to him about it. He agrees. Trypophobia is a misnomer. It's not a phobia. I'm not scared of coals. I'm not anxious. It's disgust. It had nothing to do with anxiety. It is just disgusting.
Yeah.
These two things are like different feelings. They're not all the same thing. I
Right.
think that people with OCD, I think the reason that misophonia might live in the same people as have OCD sometimes, in my understanding or my theorizing, again, could be wrong, but my theorizing is that some of the same dynamics of having parents who are intrusive or controlling or violate your boundaries and make you feel sort of encroached on, those are some of the dynamics that are often present in families of people with OCD, not always, but often. And similarly, those same dynamics might lead to a misophonia of feeling like my boundaries are being violated, I'm being encroached on. But if I get upset about it, I'm going to be the crazy one.
Yeah, interesting. Okay, well, back to OCD, and I appreciate the thoughts on misophonia because what I will say, gosh, what was it? It might have been last year's conference even. There was a misophonia talk, and it was very well attended, and people with loved ones or lived experience in their life of misophonia were desperate for answers. And it was like, well, we don't have them, but we're working on them. And
Uh,
the feeling of hopelessness there. But I think similar to how you said in the beginning, like the experts don't always have all the answers, and you can go like, well, I'm going to keep working then. There could be some other ideas outside of that. And so I appreciate you sharing with the fam here, just even a different way to conceptualize.
theory, or it's my theory.
Right.
Yes.
Yeah. Going back then to rumination-focused ERP, we talked about the importance and the difference of how the SUD scale is functioning. It's more of that litmus test, taking the pH balance of whether the ruminations are still there or not. Also, there was a piece in my researching that talked about the importance of checking in and saying, was the stopping of the rumination effortless or did it take a lot of effort to go in? And so would love for you to share more about the feeling of efforts and how that's pertainable to this model.
Okay, great question. So the idea here is that ruminating is doing something. It is trying to figure something out. And therefore, the intervention for ruminating is to stop doing certain things, stop trying to figure it out, stop directing attention, stop talking to yourself about not ruminating, stop doing these things. In other words, there's nothing active. So the reason that's important is because we want people to recognize that not ruminating does not require effort and is something that they can sustain indefinitely. In
Right.
other words, in contrast to example to a mindfulness approach, if the answer to not ruminating is being mindful, first of all, you can't take away something by adding something. In other words, if somebody is ruminating and they're continuing to do these things, then adding an intervention, something you have to actively do, is not addressing. Okay, I don't know if this metaphor is relevant, but I'm just going to go for it.
I love it. I vibe with you, Michael, because that's how I live my life.
Okay, here's the metaphor for what it's worth. If people are like, this is so off base, fine. I have eczema. And growing up, it was always about what can we do? What can we add? What cream can we use, to make this go away? In my adulthood, I realized my eczema was a reaction to things that I was sensitive to. Okay. So the answer wasn't to add anything. It was to take things away. And that really solved the problem.
Yeah.
So similarly, rumination is about things that it's not a perfect analogy for anybody who's thinking it's not, you're right.
It's
Okay.
perfect, Michael.
For rumination, this is something you're doing and we want to help you to stop doing it. We don't need you to start doing something else. We need you to stop doing something. Okay. So it's like if you're picking your nose, we want to get you to stop picking your nose. We don't need you to pick your nose and do something else.
Right.
Right. And in contrast to interventions that are like, do this exercise or focus on the present moment, those are all active things that you're doing. And we want to teach people how to not do something. And so the answer is never going to be to do something. We're teaching people how to stop doing something, how to not do something. That's number one. And number two is if somebody says my anxiety level's at 0, okay, what's your effort level? 10. Like they're meditating like the best of them. So they're working really hard at maintaining their equanimity right now. So that's not sustainable. They can't do that all the time. We want to show them that they can totally turn off rumination and they can feel totally relaxed and it's totally easy. And it's like they're lying on the sofa.
Yeah.
Okay. Because if not ruminating feels like you're running, like, oh God, that like you're going to have to keep running forever. We want to show you that ruminating is working. Ruminating is effort. Ruminating is doing something. Not ruminating, once you know how, is making the decision to not do anything, to not figure it out, to not work.
Yeah.
We want it to feel sustainable.
So an analogy that popped into my head, a metaphor, and you tell me if this works.
Go for it.
Would imagine if you're a backpacker that has like 60 pounds of weight in your backpack.
Mhm.
It shouldn't feel like effort for there to now be 40 pounds of weight. 60 pounds of weight should always feel like more effort than 40 pounds of weight. So if we take away some of the weight, if we stop some of the rumination, we shouldn't feel more effort trying to reduce that. It should just be
Mhm.
a release of some of that, right?
I
Until,
so I get what you're saying. Yeah, I get that. That's true. Also, I'm saying it should feel like 0. Not ruminating. Never feel like you're carrying anything.
fair. And I'm just thinking in the process of taking things away. But yes, I mean, ultimately
I understand.
it should
Yeah.
feel like 0. So if you're adding in an intervention, like try these shoes that will help make sure you're distributing the weight. Here's an ergonomic bag and here's a compression belt that will make it not feel as bad. You're
Mhm.
still carrying the 60 pounds.
Exactly. Yes. That's why lots of interventions that don't like lots of additional things to rub on your eczema that aren't addressing the thing itself. Yes. Exactly. Yes. Right there with you. Perfect.
Okay.
Your analogy is better than mine.
It's okay.
Right? They make a nerdy point of fact here. This is like really irrelevant, completely irrelevant, but something I learned from Dean McKay, expert on trypophobia. He says that trypophobia, that like the disgust reaction to holes, is more common in people with skin disorders and that there appears to be something evolutionary going on there. So that is irrelevant to our conversation, but just since we talked about trypophobia and here I am talking about eczema and Dean McKay is listening, I'm sure he's not, and saying like, Michael, those things are connected. So
He might.
point of interest, those things might be connected, eczema and trypophobia, irrelevant to our lives. Okay, moving on.
That is a fun fact, and I am glad that you shared it. So I'm here for all the fun facts. One thing I will say though, and overall, I totally agree, and it makes total sense that it should be 0 effort. One thing I was thinking about though, and overall, I have to say, come at me if you must, folks. It's all right. But mindfulness isn't necessarily my jam in how at least I can conceptualize it. Mindfulness has never been like super productive for me. And so I'm going to raise some big feelings for people by saying that. But what I will say is if you were to replace where you're directing your attention as a form of mindfulness, right? So I'm being mindful of I'm focusing on this or I'm not.
Right. And the problem with that would be that that person thinks that in order to not direct attention towards this, I have to actively direct attention elsewhere. And that reflects a misunderstanding of how attention works. Attention is not always directed out, such that if I want to get it off of this, I have to put it onto that. Attention is holding on to something mentally, and you can let go. So if you're in math class and you stop paying attention, it's not because you're actively paying attention to something else. It's just because you've let go of attention. And so if somebody is using mindfulness as their only way of not paying attention to that, this person doesn't understand how to just stop paying attention without directing attention elsewhere. And we would want to teach them that.
Yeah.
And that's the how to stop paying attention exercise on the website.
Yeah. That you don't have to swap it out for something else because then that's likely to just become fodder for the new rumination, right?
I would say that's kind of thought suppression. Like you could use mindfulness in a way that is not thought suppression. I'm not suggesting that mindfulness is always thought suppression. You could use mindfulness like, I'm not engaging in that, and then I'm going to sort of reconnect with the present. I don't know, whatever. But if it's okay, I don't want to ruminate. And so my solution to that is to focus on the present moment. In other words, kind of push that out of my mind by focusing actively on the present moment. Potentially, we're getting into thought suppression territory of trying to push something out. Now, I'm not saying that that's always how mindfulness will function, but I think that mindfulness can be a sloppy intervention for rumination because it doesn't exactly address technically how to stop. It's something that's sort of relevant, almost somewhat helpful in some cases, but doesn't really get to the core of the issue of how to stop. And if you get to the core of the issue of how to stop, then you no longer need the mindfulness. So,
Yeah.
yeah. By the way, in my own defense, I just want to say we have seen people in our practice who are like hardcore years
Mindfulness.
on mindfulness people who are still sick. And I recently got a letter from a Buddhist ordained Zen priest in two Buddhist orders. And he emailed me to say, and this, I put in my back pocket for a rainy day. He emailed me to say, yes, exactly. Mindfulness, the way it's taught, does not distinguish between awareness and attention. And it is not a good intervention for these issues, and et cetera, et cetera.
Yeah,
So,
it's interesting because what I will say, and again, a way that I kind of conceptualize it from my training in ICBT is grounding exercise is like an directed attention exercise to re-engage in present what's happening right here, right now. If I'm stuck in my head, that can pop me back into reality because I was really in my imagination. But if I resolve the reasoning error around that in the first place, if I resolve what was going on with OCD there in the first place, I don't have to do any kind of grounding
in other
exercise.
words, you're in that case using mindfulness or anchoring as a way of calming yourself down for a moment so you can do what actually is helpful to you, which is something else.
Right, right. And I think maybe my question there was because if we're adding in an intervention, I was kind of thinking about it in that way where I was like, well, that can be helpful for me. But like you're saying, that's not what's
Y-
leading me to the success. That gave me that
Yeah,
deep breath.
100%. Exactly. And I would say 100%, I'm on board with all of these things that are helpful. Take a deep breath, go for a run, eat healthy, get sleep, all of the things. Those are helpful. And take a deep breath, calm yourself in order to make the decision to not ruminate if you're really revved up. 100%. I don't have any objections to those things, but we're not seeing those as the intervention. We're seeing those as like, I don't know how to say this in English, a means to an end. Those are not the thing. Those are just facilitators. Those are facilitating doing the thing that's the actual intervention. Exactly.
Yeah. Yeah. So
Yeah,
that was like your little blip to kind of get back into what your main treatment strategy is.
exactly. So if you're really triggered, by all means, do all the coping skills to calm yourself down and help you facilitate making the decision to not ruminate. But the real intervention, the crux of the intervention is to not ruminate. Everything else is just facilitating that. And I'll say this is also a practical difference between traditional ERP and rumination-focused ERP is that traditional ERP would not say to do something to calm yourself down
Right.
because in their book, you yield the anxiety and habituate to it. And therefore, you would not do something to calm yourself down. But in our book, in RFERP, the goal is to not ruminate. And so, by all means, do whatever you need to do to calm yourself down enough to make that decision to not ruminate and to disengage.
Yeah, because sometimes the thought is if I'm doing something to calm myself down, that's functioning compulsively for me to not face the whatever thing is that can be the framework within traditional ERP. So that's a helpful way of thinking about it. And so this has been such a interesting chat, and this is something that is still gaining research and is still gaining some deeper understanding in terms of that. But this is a really interesting take. And again, I love that it was born out of y'all don't know either. Gonna go work on something and help figure this out. And I can't tell you how many people I have heard name drop you, Michael, saying, "Oh my gosh, this was a game changer for me." And so it wasn't just something that was helpful for you. You pursuing that has brought so much help and hope. It's brought so much hope to people. And so as we close, anything I can point folks in the fam to in addition to the website where they could learn more about you or any other final thoughts that you would have for people listening today?
I guess let's just end with hope. People with OCD tend to split between magic and despair, a perfect, ideal solution right now, and total despair that things are never going to get better. I'm always going to feel like this. And it's really hard for us to live in not having a magical solution, but still being optimistic that there is help available. And I think that's where I'd want to leave people. Don't discard things because they're not perfect, and don't give up on looking for something better. And where I am now is I'm still in my deep dive into psychoanalysis, and I have a bunch of stuff I want to write up over the coming year, I guess, hopefully. So I don't have any new resources to offer right now beyond what's on the website, but hopefully in a little while, there'll be more there.
And there are, if you look on YouTube, also if you look at other podcasts like OCD Stories, for example, Michael has also had some chats around in different spaces where you can learn more and hear more about what he's saying. But thank you so much, Michael. I mean, I have taken so much of Michael's time. He's been so generous with me, and we have had quite an interesting conversation. So I feel like friends now, Michael. Can I call you friend?
Obviously,
Yeah.
what else would we read?
They're like, P.S., that's for sure. It's our friends era, and I love that for us. All right. Well, thank you so much.
Thank you for all of your time also. It was very nice to meet you, and I'm happy to do another installment or anything else in the future. So just be in touch.
Excellent. Thank you. Thank you for that. Michael, what a fun conversation. It was jam-packed. And like I said before, y'all, I talked Michael's ear off. For all the time we spent recording, we spent about that just getting to know each other and diving into different theoretical perspectives. But I know this time was jam-packed with learning. And like I said before, I know a bunch of the fam are already hopping on over to Michael's website because they're like, what? Behavioral strategies for how to stop rumination? Yes, please. Would love that. And so again, fam, all those resources and more will be linked over at this episode's blog. Also, I believe I saw just very, very recently an OCD Stories podcast just published with Michael a week or two ago. So I'm going to link Stuart Ralph and his podcast. And I would also encourage y'all to just even search YouTube or Google for additional podcasts if you're interested in learning more about RFERP, because Michael has been very gracious in sharing and answering different questions. But the number one resource that I will maintain, and I think you will find a lot of utility in, is drmichaelj.greenberg.com. That's Michael's website. And again, you can hop over to the blog and I'll get you right on over there. So we are now to the intrusive thought segment of the show, which for new family joining us is my application segment of the show. And I'm going to challenge us all this week to try to create or expand an open stance fan. If you're an avid practicer of traditional ERP or even a practitioner, my guess is that there will be a mixture of things that you agree with that Michael shared today and challenges, key differences too. If you're an avid practicer of ICBT or treat OCD using ICBT, you may be thinking about all the similarities between these two models. And if anything, both of these approaches have a very upstream approach to treating OCD. Because if we can resolve some of these complex emotions or some of these reasoning errors, do we even get to rumination? Do we even get to compulsions? If you're an ACT lover, which again stands for acceptance and commitment therapy, and while we didn't go through it explicitly, for the interest of time, fam, I'm just going to summarize it as value-based living and/or treatment. And if you'll recall, you might be like, wait a minute. Michael was like, I'm not a fan of values language. So if you are big into ACT, you might have been like, excusez-moi. Or if you're coming from a mindfulness or metacognitive approach. There was a lot of content that we discussed in this episode. But fam, you might also be coming in with no treatment experience for you or your loved one at all. And you might be like, Nicole, we are barely staying above water here. I want you to know that I'm glad you're here and that your way of thinking about OCD, mental health, even values, it's all welcome here for all of us. Because guess what, fam? Just because we hear something that doesn't resonate with us, that we're not sure whether we agree with or not, that we see or conceptualize in a different way, doesn't mean we're not welcome. To the contrary, I'm glad you're here and I hope you continue to come back because we don't have to agree. I mean, I think Michael did a really great job of just modeling this throughout our conversation. I don't have to have the same ideas as him. He doesn't have to have the same ideas as me. And though actually I agree and align with, I feel like a lot of what he shared, the point of these sorts of discussion and this podcast isn't to create carbon copy versions of each other. But also, I think there's a lot that we can learn when we do disagree or conceptualize things in a different way. Sometimes we can take what we learned for granted, but the pruning process to really drive this planting season thing a bit further, it not only has the ability to impact our growth right now, our understanding right now, but it can ultimately lead to a more fruitful and better harvest. So the ripple effect counts. I mean, I loved how when we were talking about the subjective units of distress scale or SUDS, Michael noted, hey, yeah, I used to think that any sign of anxiety was rumination, but I've really grown from that thought, and I really think about that differently. And I love that without shame and with clarity and just authenticity, shall we say, he just said what he said. An example for me in today's talk was when we chatted about values. Again, going back to that language. What started as a conversation about avoidance really led to an interesting chat on what our definitions of egosyntonic meant. And for me, my quick and dirty go-to definition for any fam interested is when something is in line with a person's values. It's a simplified definition, but it does the job. So imagine the loop I encountered hearing Michael's take on values language. But I continued our discussion with an open stance. Because even if I think of values in my way, hearing him out led me to thinking more about why I conceptualize my simplified definition the way I do. And guess where else that led me? I mean, in revisiting our conversation, even for publishing today, I immediately thought of our OCPD warriors, which stands for Obsessive Compulsive Personality Disorder fam. And if you're all like, wait, what? OCD and OCPD? Come on, man. Those names are like practically the same. I know it can get tricky. And trust me, you're not alone in thinking that. But the point is, I was thinking about even the example of the woman knitting the scarf, right? Maybe she felt like it should be longer. So she wanted to stop. She was tired. But now she was struggling with some of that internal turmoil regarding wanting to stop, wanting it to be over, but also wanting it to be just right and perfect because it had to be long enough. And it really reminded me of so many chats that I've had with Dr. Anthony Pinto here with the fam, saying, hey, stopping short of completing something in the right way. And now feeling frustrated and distressed at the amount of time and feeling obligated to keep going, that can get really complex. And it really resonates for a lot of people that do have OCPD. And so while we didn't talk about OCPD at all, and you might be like, wait, what? Are we going down a whole new rabbit hole here? Because I'm trying to keep all the things straight. No, the point is, because of this conversation, it made me, upon revisiting it, realize, oh my gosh, I think this really speaks to my conceptualization and understanding of perfectionism that can show up in OCPD as well. And to that end, perhaps RFERP could be helpful. So I didn't have to agree with Michael, and I don't land on it where he does, and that's totally okay. But wow, some of the dots I was able to connect and now can think about and feel excited about in bringing more hope not only to OCD warriors could now potentially extend to OCPD warriors. And all this came from an open stance. Because I could have said, values? You don't believe in values? Language. I could have closed my ears, stopped that conversation there, and moved on. But instead, I'm excited by the possibility that maybe, just maybe, there's more hope. So in closing, for family members, you know your loved ones and each other best, and that's super important. And you know if their efforts of lightening the load or just taking off their backpacks altogether has been effortful or effortless. Or practitioners, you may be trained in one or multiple evidence-based practices for OCD. Or you may just be starting your learning journey because you have a client, you figured out it's OCD, and you're like, oh my word, how in the world can I help? And so I'm always going to say it's so important to dive into research. And if you check out the articles even on Michael's website, you'll see he also springboards and develops a lot of his approach from research. It's important to know what we're studying, and it's important to know when there's no research base or the base that does exist is in pseudoscience at best. But you also know, have learned, and will continue to grow in your clinical judgment and practice. You're allowed to see connections and explore interventions that may bring relief. You're encouraged to put on your critical thinking caps and think, how can we grow from here? And we're allowed to go into a conference saying, hey, even these guys don't know the answer. Even if a lot of us are, quote unquote, those guys. So many of our guests, fam, bigwig after bigwig. We've been so lucky and so fortunate, but we don't know what we don't know. And there's always room to grow. That's how we create new understandings. That's how we vet whether old interventions are still doing the thing that we think it does. That's how we discover new advancements in the field. So no matter who you are or how you entered into this discussion with us today, I want to encourage you to practice an open stance this week. Ask yourself, why do I believe this? Ask yourself, what are its limitations? Ask yourself, what are some possible options that could support or expand my thinking, whether it's about treatment or even a really nice scar? Because fam, OCD is treatable. But hey, who knows? Maybe we could all get closer than we ever thought possible to an omnipotent era if we just continue to open our stance. Thank you for joining me and our OCD family community. If you enjoyed what you heard today, please like and subscribe to the OCD Family Podcast wherever you enjoy your podcasts. Did you find this content helpful? Please consider leaving a review. The more people that know they're not alone, the better. For more information regarding today's podcast, please visit OCDFamilyPodcast.com and remember to join the email list while you're there. It will provide you with the most up-to-date information, resources, and the down low on the family chatter. Oh yeah, nothing says family like Michael hitting home with hope that has grown. That's right, I went there. And you can too at OCD Family Podcast.